Adrian, you have a remarkable story. Tell us what happened and how Penn State Health St. Joseph helped you.
Well, I somehow ended up with a serious infection in my spine, and it was really just absolutely excruciating. My quality of life had gone down to, I say, single digits. And so through a series of visits to the emergency room, I was thankfully connected to Dr. Weaver. And through Dr. Weaver and his office, they were able to get me in for some surgery and begin to get the healing process and get me back to some normalcy of life.
Dr. Weaver, it sounds like Adrian had a pretty complicated case. How did you treat him?
Well, we met Adrian when he was admitted to the emergency room and had CAT scan and MRI studies that demonstrated a very serious infection, destruction of two of the vertebral bodies in his lumbar spine, and real serious pressure on the spinal nerves. Um, Through a biopsy, it was determined that he had infection, what it was, and since his strength was still good, we recommended treating him with pain medication, bracing, and the antibiotics early on. And that worked for a little while, but his pain was excruciating. It progressed, and within a few weeks, when he came back to the office to see us, he had started to develop a kyphosis or an angulation to his spine. The bones were collapsing more. His pain was not well controlled, and he was in intense discomfort. And did his first surgery the following day to decompress his spine from the back with a long surgery, a long incision, and a lot of tissue disruption that was very painful for him. But it gave him more of an upright posture. And I think it took away some of the deep, horrible pain that he had from the collapsed bone and the infection. And it gave him a better alignment of the spine. But he did well from that. And he got through that, the pain of the surgery, was still wearing his brace, and went on home and was doing outpatient therapies and continued his 8-week course of intravenous antibiotics. After that, he returned to see us and came back into the hospital for a second stage of the operation because the bones had been so destroyed in the front that there was quite a large gap just filled with soft tissue and not bone. And that needed to be reinforced.
Adrian, I understand you work for the Red Cross. I'm sure getting back to work was really important for you. So what was it finally like when you were able to get back to work so you could help others?
Absolutely. It was just incredible to be able to actually get back and do some work. I had been unable to really focus, unable to do work for quite a while. Just such pain, I just couldn't really focus on what was going on. And so thankfully, once I had been through the operations, the pain was, as Dr. Weaver said, was still there, but it was different pain. I knew what it was. It was surgical pain, and much easier to manage than the pain had been before. And that really allowed me to get back to my job, to focus on helping people, which is really what I do and what I love doing. And I just, thank Dr. Weaver for giving me that opportunity to really get back and do the job. And it was right into hurricane season, which is when we are probably our busiest throughout the year. And so it was perfect timing just to step back into doing my work. And thankfully, most of it right now is online, which makes it a little easier as well.
Good. Dr. Weaver, as you can hear and as you probably have heard, Adrian has such a great attitude. He was so wonderful through all of this. How important is that in the healing process?
He treated us as partners in his care. I imagine he thought we would do our part, and then he certainly did his part in spades, listening to our recommendations, implementing the care, so he took care of himself after the surgery. And throughout this time, he was always so patient, honest, and respectful and kind to all of his providers. And for that, we are really very thankful and happy that he's enjoyed such an excellent recovery.
Thank you both so much for joining us tonight.